Nigeria stands at a critical juncture where the need to overhaul its accident and emergency response system has never been more apparent. The tragic death of Adetunji Teejay Opaleye, a 32-year-old software engineer and co-founder of Bumper, last month, serves as a reminder of the systemic failures that continue to claim lives unnecessarily. Teejay was riding his power bike with full safety gear along Victoria Island, Lagos, when he was struck by a vehicle. What followed was a cascade of failures. He was left unconscious on the road as bystanders struggled to find transport. Multiple vehicles refused to assist. 2 hospitals turned him away, denying him critical care. And he was pronounced dead shortly after a hospital accepted him. Teejay's death is not just the loss of a brilliant and promising entrepreneur, it was a preventable death, enabled by an inadequate awareness of our emergency response system and patient rights. Bystanders had no clue about the emergency service framework, as there was no mention of anyone calling the emergency response number of 112 for immediate emergency support. This is a number that is known to be active and responsive in at least 17 states in Nigeria, including Lagos. They were also unable to provide life-saving first. Over 70% of trauma deaths occur before reaching a hospital in Nigeria due to inadequate on-the-ground support to victims. We need to do better. There is a need to embark on a public awareness campaign on the use of 112 and train community volunteers, police, and road safety personnel in basic life support like CPR, bleeding control, and all of that, as this can empower them to act as first responders. There is a need to enforce Section 20 of the Nigeria National Health Act, which mandates that a healthcare provider, worker, or establishment shall not refuse a person emergency treatment for any reason, and there are penalties attached for non-compliance. Teejay's death demands more than mourning. It necessitates immediate systemic change. Until Nigeria prioritizes a functional emergency response, more lives will be needlessly lost. Let its tragedy be the catalyst for a system that values everyday life.
If I just come in, where you talked about let this strategy be a catalyst, you know, for me, that's one thing that really pains me about the tragedies that happen in Nigeria. They are never catalysts. We move on.
It doesn't change anything.
It doesn't change. Even, for example, you see a lot of things that have been changed in a number of countries. It's because something happened to someone and someone took it on. I used to be one person when anybody is looking for anything, medical aid on social media, whatever it is, I would donate something. And I get to a point, these people get well, they move away. They don't bother about others who don't have access to social media. Like the sickness you had, somebody else had it. What are you doing to make a difference? And it's just like, you know, it goes on. One thing also that I think that we fail repeatedly to understand is that we're all victims waiting to happen.
That's right.
You are, I tell people, I say, look, this Nigeria, being a victim in Nigeria is a matter of when, not if. Because the victim card is going, it's not that if you become a victim, no, it's when
it will touch everybody.
It will touch everybody. So what are we doing to prevent this? What are we doing to put this in place? The act that you talked about, there are penalties. How many people have been punished? Who have faced the consequences of turning someone away and not treating them? And you know, just like what Bright had said earlier, people are afraid. If you help him now, you carry him, the police will be on your, will not turn you into like you're the murderer. Because a lot of people have fallen victim to that. You know, they try to help, they picked someone, maybe he died along the way or something. They are not the ones that are being punished as if they're the ones who actually did that. We just have a failed country, failed system, no governance. And one thing we all have to understand, this saying that inshallah it will not happen to me, I'm covered in the blood of Jesus, it's not happen to me, it's not working. Because the people it's happening to, they are also covered with such a selfish bunch of people.
I mean, we need to be putting names behind this. You said 2 hospitals denied him treatment. They have names, Nabi. Let's call the names of the hospitals.
Like we should start naming and shaming.
Yes, let's call the names of these hospitals so that, you know, things can happen. So I can't say where I live exactly, but I live in a certain place where the road to that place have been one lane for a long time. Recently, they now did another lane, right? So it's easier for me to like just drive straight down to town and drive back. And yesterday I was just, because I just opened the road, so I was just driving and I'm like, damn, so easy to actually get things done.
Yeah.
Like, how much did this cost? How long ago did they put this in the budget? Why did it take this long? Right now, there's a whole lot of that whole area now is now open to a lot of people who can afford certain amount of rent because there's a road that leads them to town and back.
Accessibility.
15 minutes, 10 minutes. Before it's like 2 hours because of the traffic. And in my head, I'm like, why is it that our leaders don't understand that when they do what they're supposed to do, they benefit from it too? Like, why would you take money that you can use to better your society for a lot of people, and you take it to yourself and you spend it within yourself and your family, and you're buying Lamborghini for people? Like, why? Like, how selfish, how inconsiderate, how wicked are you to see that if you just do the little things, that it affects not just you but everybody around? Like millions of people get to benefit because that road works. Why can't we do the same thing for our healthcare system? Whoever is in charge of that budget, why can't we implement it properly? My friend always say, Bright, the way you're living your life, you're driving yourself, you're going home by 12, the day Nigeria will happen to you, you go no self to no day.
No, there's not.
This guy is a successful CEO.
Maybe for good.
He's a successful CEO.
He doesn't even live here.
Do you understand? Can you see that it happens to both the rich and the poor?
Oh, gosh.
So when we that have the opportunity to have a voice, that are privileged because we're able to boycott all of the different things that people within the lower part of society are going through, understand that one day, if you do not do anything about it, like Aisha said, if you don't do anything about it, it will come for you. Because the day you mistakenly get into an accident, your crew is not going to be there. Your family is not going to be there. It's those people in the lower part of society that you ignore every single day and drive past them like a bad boy, that people are going to be around and going to be like, I don't want wahala.
I'm thinking solutions, right? So what do we do? I mean, this has happened so many times. People get into medical crisis. They're unable to get help, support, and all that, and then eventually they die for reasons they shouldn't die. And this brings me to the whole health insurance thing. Today, yes, you quoted the right legislation. The challenge you have is that even as of today, there is no good public option in terms of health insurance. There are a lot of private health insurance programs for big men like Bright and co. who can afford it. There is a solution to this. We have to find a solution where people can buy into a health insurance plan, all right? We have 200 million people, okay? So let's even say that 50 million of that, okay, are able to buy into this health insurance with like 10K a year. That's a huge pile of money that you can have that can guarantee a lot of all these emergency services that we're talking about. The US today has this Amber Alert thing, all right? Now, we heard that word. We didn't know that actually happened because there was a 9-year-old girl called Amber that was murdered, and the family after the whole thing came back together, and then they went and pressured Congress, all right, and then the Congress passed that Amber Alert system such that once any missing child, okay, is passed into that system, that alert would show up on every phone in the entire United States. So so in terms of what does this tragedy, Teejay's death, what does the catalyst that comes out of it? For me, I think that the people who would support him, I mean his family and all that, they should also make sure that at the end of the day, they make a strong advocacy to make sure that there's something that comes out of this so that they can be sure that this doesn't happen to another biker again. But beyond that, for me, we need to look at our health insurance system because it's broken and we need to fix it.
There's a correlation between your advocacy and Aisha's advocacy. While Aisha addressed the mob, you addressed the more refined people and how Nigeria happens to them. For me, I'll take it back to storytelling because there's a way drama mirrors reality. I would say our storytellers should be able to put this in their storytelling. Nigerians like movies, we like the films, we like our celebrities. They should be portrayed in some of these instances, in some of these scenarios.
Advocacy.
So that we then learn how to do emergency responses, we learn how to use fire extinguishers, we learn all manner of things. We see why it is wrong for somebody to be dying and you're just standing by taking, recording and watching life ebb out of that person. We need to also continually harp on the fact that the Minister of Justice died in this country. Until now, the case is inconclusive. So if you have that kind of high-profile person die and nothing gets done at the end of the day, how much less ordinary citizens? Look at this. I read just yesterday that somebody also came from the diaspora, was picked up by the police because of the happening at Uromi. Because policemen are randomly picking people there. So this guy came, he had to bail himself out with ₦1 million. I read that in one of the newspapers. So you see, there's also the contribution of the police force to all of these. If you keep victimizing people who try to help, just as somebody said here, other people are going to be scared of stepping in and helping people to survive. So as a people, we need to have this conversation on a larger scale. Our legislators, I keep saying legislators because they are entrusted with the Constitution at the local level. So if you're not doing anything and just sitting every day, standing allowance, sitting allowance, what about the people you're supposed to minister to? And I use that word loosely, not in the church context. So as a people, we have to want to move forward. A pregnant woman died because a hospital refused to treat her without a deposit of 500K. Well, how many regular people have 500K to deposit in Nigeria of today? But that woman died.
Time over time at the table, we've spoken about a National Orientation Agency and how they should engage different parties to pass across their message. Again, the message is to the National Orientation Agency. You can engage storytellers, artists, kit makers, musicians, to amplify whatever message that is relevant to the populace. We have identified that the way we consume information is through media. We can do a whole lot more in that space. Except society is founded on the premise that every life matters, it bears more resemblance to a jungle, right, Yinka?
Without a doubt, Zuma. It is therefore a sign of degradation when we fail to provide for the weaker ones amongst us.